Okay, good afternoon, everybody. This is Karen Lee Harrington with the Maine Health Data Organization, and it's a little bit after 1 o'clock, so I think we'll go ahead and get started. I think people will still be beeping in, so I apologize for that. But in any event, I want to thank all of you for taking time out of your busy schedules to join us this afternoon. Full agenda, and so I'm going to jump right into it. And before I get started, I just want to make sure that we say now, and we'll close reminding you that if issues come up and you have specific questions, feel free after this webinar to send an email to the Maine Health Data Organization. I know it's difficult with as many people that have signed up for this webinar to have an interactive discussion. So this presentation is a little more of a presentation, briefing you on the status of a number of different things, and then clearly we want to be able to address any individual questions or issues that you may have offline. So with that, I will turn to the deck, and hopefully you're all logged in through the webinar and you're looking at a PowerPoint presentation. And Kate, if you can move to the next slide. So this afternoon, the items that we want to hit on, we want to just take a few minutes and brief you on the key changes that we're proposing to Rule Chapter 243. We want to talk about the timeline. We want to talk through some of the work that we're doing around building reports in the portal for you to access that have to do with compliance, validation, etc. I want to share with you some early results from the satisfaction survey that we have put out on the portal, and if you have not taken it, I strongly encourage you to do so. And then I want to update you on some work we're doing with our health cost website, and a request that I have for you all to consider. And then, if time allows, at the end, I just wanted to share with you some of the key deliverables that the Maine Health Data Organization is working on over the next 12 months as it relates to our bigger project, transformation at large. With that, I think Kate, we can move on. I'm going to turn the mic over to our compliance officer, and he will walk you through high level some of the key changes that we're proposing as part of Chapter 243.
Thank you, Karen Lee. The first point is ICD-9, ICD-10 information, and the biggest point there is that we have, instead of using an indicator and dual purpose or repurposed fields, we are going with 2 blocks of data elements and no indicator. The old fields, MCO 39 through 53 and 55 through 58, will be used for ICD-9 as long as you have them. And when you run out of ICD-9 codes to send, you can simply leave them blank and use ICD-10 codes with the ICD-10 fields for those codes. And the ICD-10 fields are the ones that are 200 through MCO 200 through MC 326. Again, you may not have all of these fields. Instead of providing defaults, you can simply null them out and indicate through the portal that you do not capture these fields, and the thresholds will be adjustable. With respect to provider and service facility information, I have received a very interesting question for clarification as to what is going to happen to MCO 33, 34, and 35. There is a mistake in the revised draft. I will be correcting that. The data element numbers should not have been struck out. We will remove that, and they will remain as placeholders, and payers will leave those blank. The information that was provided there was asking for service provider location, but they were mapped out to service facility location, which is what I'm really looking for. All of the service facility location fields have now been moved to the 80s and 90s, MCO 89, 90, and 91, and they have been supplemented with name, address, tax ID, and NPI. That is where service facility location information will now be collected. Billing provider field information has also been expanded, and all of these extra fields hopefully will give us the additional information that we need to help resolve provider identification issues and improve our provider indices. Again, and I can't state this too many times, if you do not capture certain information that is being requested, simply indicate it and your thresholds will be adjusted. This is preferable to supplying defaults such as unknown. And finally, this is a rather small change. We used to collect DEA number and NPI for prescribing physician in the pharmacy file in the same field. We are breaking that out. The fields will be separated. DEA will remain in PCO 47 as originally intended, and PCO 48 will be a dedicated field for prescriber NPI. Are there any questions, comments, clarifications needed?
Hi, my name is Candy Schaefer, and I apologize if you said this earlier and I missed it, but where exactly can I get my hands on the new detailed layout that includes the fields up to 326?
I believe we have posted that. Have we posted it yet under proposed rule?
So we had emailed it out to a broad group of contacts, and I think many of you are on this call, but we will make sure that the document is also posted on our website after this call.
Okay, thank you very much.
And regarding being part of a notification list, if you have general interest in these notifications, you can send your information and your company affiliation to me, and I will add you to the portal information for your company, and you will receive notices in the future.
Okay, thank you very much.
So this is currently just a couple of additions to add to Phil's comments. By the end of this week, we will have posted on our website and on the portal a document that lists a number of questions that have come to our attention after many of you have reviewed these proposed changes and our responses to those questions. It will all be de-identified, so it's not going to be reported out by payer or anything like that. It's just an aggregated list of questions and our responses to those questions. And as I said, that will be available through our website and also on the portal. And I guess I'd also say that what we've described here is sort of a summary of the primary proposed changes, but there are other changes as you look through the document. And again, I know it's difficult in this format to raise questions, but I do think that we do want to take a minute and ask if there are any questions or comments that you feel that we should address at this level. And if not, we are certainly available to talk to you one-on-one offline.
Hi, this is Bill with Delta The changes that you just described, they are for medical and prescription. Is that correct?
That is correct. There are no changes that I know of to the dental file.
Or the eligibility. Is that correct?
Again, these are the changes that payers have not already made. There were changes made to the way that fields were hashed previously in the eligibility file. They are no longer hashed. There is no longer a field level encryption. There is a file level encryption, and payers are already doing that. So these basically are the changes that payers haven't already implemented. So there are no additional ones, to my knowledge, in the eligibility file.
Thank you.
Okay. If there are no other questions, then we'll move on to the next item, and that is the timeline. So we've heard from many of you in terms of, what is the timing for these proposed changes to go into effect. And here is high level the timeline and next steps. So we will go to public hearing most likely in the month of April. I did talk to the MHDO Board of Directors this morning, and I was given authorization to initiate rulemaking. So we actually could go even earlier. I know time is important here, as you all need as much lead time as possible to begin the work that you need to do to make these changes happen. So this may be subject to change, but we will certainly keep you notified if we move the hearing to March. At this point in time, we're thinking April hearing. April 14th is when we have to respond to any public comments that we receive. I will work with the board and with staff on those comments, and then the goal would be by May 1st, no later than May 1st, the board would vote on provisional adoption of the rule change. And I think at that point, you can feel very confident that you can move forward. And again, best case scenario, we move this all back a month so that we would have the provisional adoption in April. But we will certainly keep you posted. Again, we've received a lot of feedback that the sooner we can move this through, the better, so that you've got the lead time that you need to make the changes as required by the rule.
And then, I'm sorry, then when would you actually expect the changes to be effective?
So my understanding, and Phil and others jump in, but the change needs to go into effect no later than October 1st of 2014. And in order to sync up with the conversion with ICD 9 to ICD 10, we're committed to giving you guys, as best we can, about 6 months to get this structured into your systems. We will need, obviously, to do some testing. And so one of the things we'll be doing is communicating with you around a timeline for test files once we get closer to our April date. So if you're interested in being part of a beta testing group, please reach out to Phil, but we will do a mass communication regarding timelines around effective dates and testing. Phil, do you want to add anything to that?
Just one thing. With the timeline that you're looking at right now, it would be likely that if 5/1, the board reviewed the comments and voted on adoption of the rule, that basically language of the rule would become effective at the end of that month. And unless otherwise indicated, like for example, many of the fields are effective 10/1, the general language of the rule would be effective at the end of the month. And the elements, the new elements or other changes, if other than 5/30 or 5/31, 2014, would be for October 1st, 2014. And then, of course, with the testing period and, finally go into a production system, as Karen indicated.
So we will get a clarification out probably within the next month or so around what we think the testing time frame will be and whether or not this hearing will take effect or whether or not we'll hold it in March or April. Okay, I think that's what we wanted to get out there to you all relative to the timeline. So I think at this point, I'm going to turn the controls over to Leanne. And
yes,
Leanne
thank you, Karen Lee.
Is with our consultants, HSRI, and they've been helping us, as you know, build this new portal, and so with that, Leanne, I'll turn it over to you.
Great, thank you, Karen Lee. So today I'm excited to talk to you about some new reporting features we have made available on the portal, and also some ones that we will soon make available on the portal. So these new features will help you better monitor your data submissions using the compliance report and better understand how your data compare to the validation threshold using the validation report. The last reporting feature that we will highlight is our analytics platform, Tableau, that we are planning on implementing for you within the portal over the next few months. So some exciting things to come. Finally, we want to hear from you about some other information needs that you might have that we haven't covered, so we can explore additional reporting features within the portal to meet those needs. So let's begin with the compliance report. All users who are either an administrative contact or data submitter can view the compliance report in the portal. This report was made available the last week of January, so anybody who is an administrative contact or data submitter should now see a new reporting tab, and we'll show that to you in a moment. The report was designed based on specifications defined by MHDO in order for payers to be able to view month by month, file by file, what required data have or have not been submitted and whether they are in compliance. Now we're going to switch to the live demo. We do want to thank Harvard Pilgrim Healthcare for allowing us to use their compliance report for our demo. Okay, so on the compliance report page that you will see up on the webinar, you will see a summary of all files for the current calendar year and their status. All columns can be sorted by clicking on the column name. And now I want to take a minute to explain the different filter options available on this page. You can filter on the year, the company suffix, and the type of claim. This table contains a calendar year of data. It's currently showing 2013. But as soon as the deadline for January 2014 data file passes, this will show 2014 data, and then you can switch between the 2 years. If your company utilizes multiple company suffixes, you will be able to select a particular suffix also using the filters. If your company does not have any suffixes, a dash will show, as you see here. The type filter allows you to select by the type of file. It will default to showing all file types, as you see. You can select by ME, the member eligibility, MC, medical claims, PC, pharmacy claims, or DC, dental claims. The report you see here displays all of the file types that your company is required to submit for, the months those data are due, and the status of the submission for that month. As you see, Harvard Pilgrim has all files in pass status, which means the file has passed all the validations and the file is compliant. It then lists the file ID and the file name of the compliant file. The other possible statuses are missing, which means the file has not been submitted and the file is not compliant. Failed, which means the file has been submitted but still has outstanding validation issues. This file would not be compliant until all issues are resolved. And finally, for quarterly data submitters, not due would show for all months until the month their data are due. Once a month's deadline has passed, the missing, failed, or passed status will be displayed. Now let's look at the action options, where you see the blue buttons. There are 3 actions available for submitted files and 2 for files not yet submitted. If the file has been submitted, you can view the details of the file by selecting Details. The Detail button would show what validation issues occurred and the status of each. If a submission is compliant, the details will say no issues, or, as you see here, all validation issues will have the status of overridden. Next, the Notes button allows any user to enter and view notes associated with a specific file. The notes can be used to document conversations related to compliance. MHDO can also add notes that you will be able to view. The notes are viewable by users from your company and MHDO. However, after the note has been added, it can only be edited or deleted by the person who entered it. To create a note, click New Note. Once you add your text and save, the system will associate it with the file and your user ID. For files that haven't been submitted or haven't passed, if you select the extension button, it will show the MHDO compliance officer contact information, who you can call or email for making an extension request. If an extension has been granted by MHDO, the extension date will appear here in the column that says extension. As you may have noticed, we have also started sending out data submission reminder emails and late notices through the portal. The late notices will be generated based on the information displayed in the compliance report. If you have questions once you start using the compliance report, we are working on making a revised user manual available with information on the functionality of the compliance report that we just reviewed. The manual and the video of this meeting will be available in the portal next week. We will post a notification once it becomes available. Now we're going to leave the portal and discuss the next report that we are working on. We are calling the next report the validation report. It will be a report on all the validation rules in the system and how the data you have submitted compares to the standard thresholds that are set for each rule. The purpose of this report is for you to be able to evaluate your data submissions against the standards that we have set. We know that most data submitters have set up profile overrides and exemptions to bypass certain validations, but we would like to show you how your data compares to all those validations. We are also going to be using this information to assess the current thresholds and potentially reset the thresholds and your individual profiles in the future. This report will look similar to the compliance report in that it will provide filters that will allow company administrative contacts and data submitters to view all the validation rules and compare their data submissions across time against the validation. As some of you may have noticed, we recently reset almost all exemption level validations to expire on April 30th. We did that in order to allow us time to reset validation threshold standards for submissions beginning in May. We will provide updated validation information at least 30 days prior to validation threshold changes. Just to be clear, we don't plan on adding new rules, but just potentially adjusting the levels that the threshold is set at. We are planning on making the validation report available under the reporting menu in late January or early March. We will also include a new section with a user manual that describes the functionality of this report once it is made available. Now, I'd like to hand the presentation over to Scott Osborne at NORC, who is going to present another new reporting feature that we are anticipating rolling out over the next few months. Scott?
Hi. So I'm going to be telling you a little bit about a software tool that we've deployed at NORC and plan to implement for the MHDO APCD project. It's called Tableau. At its essence, Tableau is an analytics platform that's browser-based. It provides data visualization, and the keyword there is really browser-based. There's no software required on your end in order to see the visualization. Go to it right in your web browser. One of the big advantages of Tableau versus some of the more traditional reporting is that it is interactive through the dashboards. And you see this through three features. One is the tooltips, which means that you can hover over certain aspects of a dashboard and see additional information pop up in more detail. You can also drill down and filter. So, you know, if you want to isolate a particular section of a dashboard and just see information about that, or if you want to filter by year or some other group of data, it allows us that interactive capability. And finally, even though Tableau is primarily a web-based technology, it does allow for exporting the visualizations that you see online as PDF images, and in some cases can export the underlying data as flat files for further analysis if you'd like. And so at this time, I'm going to share a couple of dashboards that put together based on APCD data, just to give you a short and simple example of what we're able to do using Tableau. These reports aren't necessarily what we're proposing to publish or make available. Again, these are just to illustrate some of the features that we have in Tableau. All right, and I assume everyone can see my screen okay here. So the first example that we have here was based on a report called the Per Member Per Month report. And what we've done is taken data from the best insurance company here, and we have data for 3 months, July, August, and September of 2013. It's my understanding that some of this information was distributed as a spreadsheet or a PDF, and may not have been very usable or readable for that matter. But what we can do in Tableau is provide some interactivity so that you could go to, you know, August, for example, see the total charges here that were processed as claims. We can mouse over and see the amount that members paid for those claims, and also the amount that the insurance company itself paid on behalf of those claims. We have a couple of pieces of additional information here, the number of eligible members for this particular month, as well as the average amount paid per member. So again, this is a very simple illustration of some of the features we can publish using Tableau based on the data we're collecting for the APCD. There's another dashboard that I want to show you here. One of the cool features with Tableau that we found is the geomapping capability. And so to illustrate that, what I've done is taken the top 10 most common CPT codes, and then we've calculated the average amount that the insurance company paid for that CPT code by county in Maine. And so what we can do is just, you know, we're looking at 97,110 here. We can switch over to 99,213. I'm sorry, was there a question? No? Update the CPT code and then mouse over the different counties here to see the average amount that was paid for that code in the state of Maine. And we can highlight some of that if we want. So again, we just want to demonstrate some of the functionality that we're proposing to put forward using APC data. APCD data, and we think this is really going to be helpful in terms of not only making the data available, but making information more readily accessible to both the public as well as the payers.
No, that was
Is that, are we supposed to be able to hear that person talk or no?
I don't think so. This is Karen Lee. I don't think she's part of our
Okay.
part of our team. Having said that, Scott and Leanne, are you guys finished with the demo on the reporting functionality?
I'm finished on my side, yes.
Yes, Karen Lee. Yep.
I thought it was only an hour, but they showed it an hour and a half.
Okay, so maybe before we go on to the next topic, if you are on the call and you're having maybe a sidebar conversation, could you just mute your phone? Don't put it on hold, but if you could mute, that would be great. Okay, so back to the deck. I think that where we want to end things relative to the reporting is this was a very high-level, quick overview of some work that we're doing on reporting that will hopefully help you. I know we've gotten a number of feedback from folks asking for reporting on the status of the validations, and so it's in the works, and we will, I think, have a much more detailed conversation once the reports become available. But we certainly want your feedback if there are other items that you're interested in us reporting on. So please feel free to email our compliance officer. I know many of you know Philippe, and he will make sure that your feedback is passed along while we work through the reporting. And I think it's safe to say that this is a work in progress. I mean, I think, we will have future releases of the portal. We're going to be continually looking at ways to improve it. And I think that is maybe a segue into the next agenda item, which is the satisfaction survey. We put a survey out with about 19 questions. To date, we've received 28 responses. You'll see the breakdown of the categories of people that responded. And the survey is still out there on SurveyMonkey. So please, if you haven't had a chance to take the survey, we would encourage you to do so. We've gotten some really good feedback, but certainly know that, the majority of you have not yet responded. If you cannot access SurveyMonkey through your employer, if you print a hard copy of the survey and fill it out and send it to us, we will put the results into SurveyMonkey so we can roll it up with the rest of the online reporting. I think if we go to the next slide, I wanted to give you just a quick, again, it's not a whole lot of responses, but it is something to start with. And so I was actually very happy to look at the graph that you're looking at right now. The question was, overall, how satisfied are you with the data submission process? And although you don't necessarily have the exact numbers there, about 96% of those responding are somewhat to extremely satisfied. So I think directionally that's really good. There's still room for improvement, but I think we were pretty pleased with that. If we go to the next slide. So one of the issues that we were trying to solve for in our new process and working with our new vendor was the whole validation process. And so again, I feel like directionally we're on the right track, 88% of those responding indicated that they are somewhat to extremely satisfied, with about 12% indicating that they are unsatisfied. And I'd like to understand from the 12% that indicated that, what are the issues? So, although, you know, we're happy that the majority of those responding are satisfied, we clearly want to understand what are still some of the barriers that people are struggling or dealing with. So again, either fill out the survey or please call me directly. My email, my phone numbers, everything's out there online, and I'd love to have the conversation with you. And then lastly, overall, how satisfied are you with the new portal? And you can see there, again, overwhelmingly, people are indicating that they are somewhat to extremely satisfied. So again, I think directionally we're on the right track, and with your ongoing feedback, hopefully we'll see those numbers go up even higher. The survey allowed for people to write in suggestions or recommendations to be more specific in what some of the challenges and or concerns are. And so we are in the process of reviewing those with our consultants. We will categorize the feedback and we'll put it out there so that you can all take a look at what has been said. And we will keep you posted in terms of what we will be able to incorporate in terms of improvement based on your feedback in future releases. So I think we can go to the next slide and the next topic. So one of the things that I wanted to just brief you on to make sure that you are aware of is the health cost website that the Maine Health Data Organization has built, and it is currently a version of this website is on our website. We are in the process of improving this site, and in fact, we were awarded a grant from the federal government back in September of last year in the amount of $2.6 million to continue to refine and improve the information that we're putting out to the public. And there is a law in the state, in fact, a statute that governs Maine Health Data Organization requires us to put this information out there. So I know we don't have a whole lot of time to get into all of the specifics, but I would be happy to talk to anybody offline about this website, but I would encourage you to, if you are not familiar with our health cost website, take a look at that. And one of the things that we will be doing over the next month or so is releasing an updated version of health costs. It is not our end state, but it is an interim state, and it's one step closer to end state. Our end state vision we will achieve over the next 18 months. And we will include, I think on the payer so that you guys can see this, it's on our website, but just so it makes it easier, the abstract that we submitted with the grant so you can get a high-level overview of what we plan to do with health costs going forward. The reason why I bring this to your attention is because one of the things that we would like to do is include the links to health plans that have some sort of cost calculator or some sort of tool that you make available to your members, so that as people come to MHDO's health cost website and they get a sense of what the cost on average is paid to certain facilities, they could then click on to the link to their health plan and better understand what their out-of-pocket costs may be. So again, I know we don't have time to get into all the details of health costs, but I would encourage you to take a look at it. And if you are interested in including your link to whatever tool that your company may have available for your members, we would be more than happy to include that link on our site. And not to confuse things any more than they probably already are, but in our existing health costs website, there is no section where we include links to payers' cost calculator tools. This is something new, and it's in our new release, which is currently still being reviewed internally. But there will be a page on our new site that is called Resources, and that's where we would include all of these links. And again, I'd be happy to talk to anybody offline that's interested in more details around this. But we really see this as a way to help consumers that may come to the MHDO site to get an understanding of what the cost of a procedure is on average, but then link to their individual health plans to understand what their out-of-pocket costs might be based on their individual plan. There are a couple of laws in the state that require providers to provide their patients with information around price, and it also requires the provider to notify their patients about the tools that the Maine Health Data Organization has available on its publicly available website. One of those laws in particular went into place January 1 of this year, so we anticipate that there'll be more people potentially coming to health costs. And I'll just close by saying, on the current site, there are about 29 procedures that are posted. In our new site, there'll be about 196. And again, this is just an interim step before our end state, but it will be an important release for us. And if you want to be part of that, we certainly, again, would welcome to include your links to our site. Okay. We are running a little bit ahead of schedule, so maybe just to pause for a moment. I know that was not a whole lot of information about health costs, but some information. Are there any high-level questions that I can respond to relative to health costs? Okay. Hearing none, then I think we'll go to the last item on the agenda, which is, again, just briefing you all on some of the other work that we are in the middle of, or we will be starting over the next several months. Because remember, we are going through a full organizational transformation that includes all of our systems and streams of data. And so just a couple of activities that are going on. As I mentioned earlier, we'll be using your feedback to improve future releases of the portal. As Leanne and Scott talked about, we'll be finalizing the reporting features. We will be continuing the work to build our data warehouse, making the changes, as I just sort of high-level articulated relative to health costs. And this last bullet is a little bit misleading, and my apologies for this. We'll correct this. we will be looking at, as part of our work, integrating some cost and quality information into health costs. And again, for those of you that are interested in what that means, we'll make the abstract available on the payer user group page, so you can get a better sense of what we're thinking about. And there are many, many more things going on, but these are some of the key activities that I just, again, wanted to make you all aware of. And then I think if we move to the next slide, I think that concludes the issues that we wanted to discuss with you or brief you on today.